First and foremostly, can you give us an update on the scale of the disaster as told by your people on the ground?
Okay, so I'm sure your viewers have seen the scenes of devastation that's been broadcast worldwide. I would like to add, though, that people living in the Philippines are used to tropical storms, but certainly not at this scale. I mean, it is unprecedented. The view that we have is partial. So, although what we see is quite vast in its scale, the devastation, it's what we don't see that's really most worrying at this stage. As you know, the Philippines made up a chain of islands of about 17,000 of these islands, and so there are very small and remote islands where there are smaller villages that perhaps have not established contact with the outside world due to the disruption in communications, logistics. So it'll be some time before those communities can even be reached. And so our team's on the ground now. We've got about 23 people that are currently coordinating our efforts. And first order of business for them is in Tacloban, outside the airstrip. They've set up a medical facility to help people coming in with mainly sort of injuries like broken bones, cuts, lacerations. These are the kind of injuries that we need to treat really quickly before infection sets in. But we also need to provide adequate supplies to existing medical infrastructure that's either completely swamped by the need, the number of people coming in seeking assistance, or also where there is no medical staff currently. So by the end of the week, we should have about 100 international staff and Filipino staff working on the ground. The difficulty that we face currently is in getting the cargo in. So we've got 9 cargo planes that were ready to land in Cebu on that island, but we're unable to do so due to bad weather. So we're going to have to redirect those planes to Manila and find a different way. I think that sort of also tells us a bit about the logistical nightmare that this response, this emergency response, is going to entail. So we've already started planning. We've already got 4 boats that we've chartered that will have autonomous medical teams on them that can go out to these outlying and remote islands to assess the needs of the communities that are still without assistance. Also chartered a helicopter to do the same, so helping us to do assessments to reach communities.
Now, you've mentioned 17 islands, so how widespread is your involvement in the rescue operation or the emergency response on the ground in the Philippines?
So at this stage, we're focusing our efforts on Cebu Islands and Leyte, but also progressively on Samar Island. These are 3 islands that were particularly hard hit. And as I say, as our teams make their way to communities, they'll actually get a better idea of what the exact medical needs are. For us, the first priority is clearly to provide urgent medical care. In your package just now, you would have seen a woman talk about her infant dying. The same goes for pregnant women. Just because it's an emergency doesn't mean your baby is going to wait until it's over. Also, people who suffer from chronic conditions such as diabetes, they may find that their diabetes medicine, their insulin, may have been in their homes. These have been destroyed. So it's obviously much wider than just the immediate cuts, broken bones, and injuries that require surgery. But it's also supporting a health system that's also struggling to deal, yes, with the massive influx of need, but also with their supplies. So as another example of what we've done in emergencies like this, we deploy inflatable hospitals. We did this in Haiti with good success, where if your medical infrastructure, your hospitals, your clinics are destroyed, we're able to set up an inflatable hospital. It consists of an operating theater and also a recovery ward. And that can replace damaged or flooded infrastructure.
Now, looking at the work involved in the Philippines, it seems quite massive. How can South Africans donate, and what can they do to get involved?
Definitely. We're really looking for support from the South African public in 2 ways. If people want to get involved by donating to Doctors Without Borders, they can do so by visiting our website. It's www.msf.org.za, and they can just click on the donate button. Alternatively, you can also dial a toll-free number, 0800 000 331. But we're also appealing to South African medical professionals, so surgeons, doctors, nurses. We need skilled staff to provide the care for people on the ground in need. So currently we've got about 18 South Africans in a pool that are on standby and ready to go. But we're always looking for skilled medical staff, people with experience as emergency coordinators, to work with us in emergencies like this. So if there are people out there who want to get involved with us, they can call our office in Johannesburg on 011-403-4441, or they can also visit our website and click on Work With Us.
Mm-hmm. Right, Borrie, thank you so much for your time. Let's give you that website address again. It is www.msf.org.za. That is the website address. You can call their toll-free number on 0800 000 331, or you can call them at the office number 011 403 441. These are the details that you can contact Médecins Sans Frontières. That was the MSF Africa Director of Communications, Borrie La Grange, here on the line to us.